Our next speaker is Professor Somesh Gupta. He's a professor at All India Institute of Medical Science. He's going to tell us about comparison of lab indicators and clinical efficacy of non-cultured epidermal cell suspension and hair follicular cell suspension in surgical management of stable vitiligo. Over to you, sir.
Thank you, Dr. Salim, and thanks to organizers for giving me opportunity to speak here. When I received the acceptance letter of my abstract, I informed Dr. Ilfad Hamzavi and Dr. Prasad that this paper in the meantime is published. So I would like to withdraw, but they said, no, you go on and just inform the audience that this is published. So before I move, just to declare the conflict of interest, I am conducting 2 clinical trials on JAK inhibitors sponsored by Pfizer, but I am not discussing these drugs in my talk. So little bit of journey before I come to the main paper, that we started working on hair follicles as a source of cell suspension way back in 2007, started doing some experimentation, and finally we published our first report on this extracted hair follicle outer root sheath cell suspension in 2011, and it showed good promising results. And however, in the meantime, another paper came after we started working on it and suggesting that plugged hair follicle can be a good source. So it's a very exciting idea, because extracted hair follicle, they never grow back. But plugged hair follicle is an unlimited source of cells, because if you plug the cells, they will regrow. You pluck more cells, more hairs. So, however, when we did a comparative study, we found that the percentage mean cell viability was similar, but the mean repigmentation in the plugged hair follicle cell suspension was just a fraction of what we get in non-cultured epidermal cell suspension and extracted hair follicle cell suspension. So 78.89% patients percent repigmentation was with the NCES, and with hair it was 73.67%, but only 17.78% with the plugged hair follicle. So it's not a good source, and we don't know whether this little bit of repigmentation was because of dermabrasion or truly because of the transplantation. So this is on the left side, it is the epidermal cell suspension, middle it is hair, and on the right side it is the plugged hair. So plugged hair do not work, and there is a reason for it, because hair grows after plucking. This means crucial cells are still there in the empty hair follicle. It is not empty. It contains cells which are growing the hair again. So we studied plugged hair versus extracted hair, and we found that in plugged hair, there are many cells missing, including keratinocyte and melanocyte stem cells. So this is not a good source of cell suspension, preparation and transplantation. Then another study published from PGI also suggests in the same direction. So plugged hair follicle is not a good source. Then we did a pilot study of again using the hair follicle cell suspension, and we found that again the results were not really very great. The mean percentage was 52% was the mean percent repigmentation, and vitiligo vulgaris showed the maximum repigmentation, and acrofacial and segmental did not show that kind of repigmentation which we expect. So then we again did a study to find out whether the hair follicle cell suspension can give better results in repigmentation of leukotrichia, the white or poliosis which we see in vitiligo. So we did a randomized control trial of hair follicle cell suspension and epidermal cell suspension. So again, while it was very good these cell suspensions were very good in epidermal repigmentation, but they were not so good in hair follicle repigmentation. So these tall green bars are epidermal cell, the skin repigmentation, and the blue are the hair follicle repigmentation. So hair follicle repigmentation doesn't occur in this. And again, oh, it's very quick. So I will just, we tried to improve the cell yield of hair follicle cell suspension by adding collagenase 1 with trypsin. And we found that there is some increase in the, not only in the cell yield, but in repigmentation. So we further want to do more work on this. So coming to this current study, this is evaluation of clinical efficacy and laboratory indicators of non-cultured epidermal cell suspension and hair follicle cell suspension. So this was again a randomized trial, and it was a single center, and 74 patients were randomized. The target was 96 patients, but we could not complete because of the lockdown and COVID pandemic. And the percentage of repigmentation was assessed at 9 months. So a little longer follow-up than usual, and cell suspensions were analyzed. So repigmentation with ECS, epidermal cell suspension, was significantly higher at 4 weeks and 16 weeks. But at the end of follow-up, both arms had the similar repigmentation. There was no difference. And excellent repigmentation was seen in 61.7% in epidermal cell and 53.2% in hair follicle cell suspension. And complete repigmentation was observed in 6.4% in epidermal cell and 12.8% in hair follicle. So this is excellent repigmentation with epidermal cell suspension, and this is an example of hair follicle cell suspension. So there was not much difference in the final outcome. So if you see that initially there is faster repigmentation with epidermal cell suspension, but if you follow these patients long enough, no difference between the two arms. So again, some laboratory data. I will just take one more minute if you allow. So significantly higher cell yield and percentage of HMB 45% positive melanocytes were there in epidermal cell suspension, and no difference in proportion of S100 positive cells. Possibly these are melanocytes. So just want to summarize here that the cell yield in epidermal cell suspension was 8 to 9 times more than hair follicle cell suspension, and still the final results were very similar in both the groups. So the problem here is that we don't have the process to improve the yield in the hair follicle. If we can improve the yield from the hair follicles in preparing the cell suspension, possibly it will provide a better outcome than epidermal cell suspension. So these are just laboratory staining done for immunostaining for different types of cells. But in conclusion, epidermal cell suspension provides faster repigmentation, that's not a doubt. But eventual repigmentation was similar, even with 8 times less cell yield in hair as compared to epidermis. And we need to work and find out methods to improve the cell yield in hair follicle. And ECS and HFCS have comparable safety and efficacy if we follow these patients long enough. And I must acknowledge a team. It's a work of a large number of people. I cannot name everybody here, but it's a teamwork which is done at our institute of All India Institute of Medical Sciences. Thank you for your attention.
Can I ask a question?
Yeah.
Well, first of all, Somesh, there's 2 incredible pieces of work that have happened in the past 4 years. Thierry Passeron's work looking at epindermal and it not working, and your and Devinder's work, but you doing all this work and showing a negative study, it really inspires me, because that tells you that the human bias to say, look what I did, you didn't allow that to happen. This innovation, that is a very difficult study to do, and you did it, and it didn't add much value. So congratulations and thank you for that effort. Secondly, why is it, and this is my interpretation, that cell viability does not correlate to pigmentation? The Dutch group has also shown that in other studies, but that's my interpretation of the literature. We did all these, tryptan blue and all those other assessments, but it doesn't correlate. Are we looking at the right target? Do you agree with that assessment? Can you comment on that?
So cell viability definitely affect the overall repigmentation. If the viability is too low, then obviously we are not going to get any repigmentation. Now, if we have millions, because we are transplanting millions of cells, so 70% viability and 90% viability is not going to make a major difference. But if we transplant a smaller number of cells, then the cell viability is going to make a difference, because overall absolute number of cells transplanted will become very low. But we found that if we incubate for longer period, or if we use higher concentration of trypsin, then outcome suffers. So definitely cell viability has a role to play.
So it's a threshold, but it's not a...
Exactly,
Okay.
exactly, yes. Yeah.
Excuse me. So what's your inference on leukotrichia, that repigmentation? I might have missed it somewhere. That what's the conclusion, repigmentation of leukotrichia?
Yeah, so we followed these patients for 9 months, and at the end of 9 months, 20% of around 20% of the hair in epidermal cell suspension got repigmented, and around 14% of the hair in follicular cell suspension got repigmented. So currently these techniques cannot be used for the purpose of repigmentation of leukotrichia. But I have a feeling that if we follow them even longer, perhaps we can get more hair get repigmented, but it is always unpredictable.
I would like to add, because in my thesis also I've followed for 6 months, and the leukotrichia repigmentation was like this only. Then I followed them after 2 years, after WhatsApp pictures and everything. So the same patient that leukotrichia completely repigmented. So in vitiligo, it takes some years to make that become that white hairs. So when the skin became that pigmented, and it will take some time to that retrograde repigmentation of the hair. So the time is also a matter. So we follow for some period, and if you follow a longer period of time, that has also the repigment. That's what I got from thesis.
Agree.
Yeah. Dr. Somesh, I'm here, Salim here.
Yes, Salim.
Yeah. So just wanted to know whether the viability, is there any way to improve the viability of because you have more number of melanocytes in the hair outer root sheath. When you compare the ratio of keratinocyte to melanocyte ratio with the epidermal. So is the yield of melanocytes much more with your hair follicular suspension when compared with your epidermal cell suspension?
So that's a good question, Salim. So what is, if you feel the texture of the hair and texture of the epidermis, there is a gross difference. Hair follicle cells are tightly woven with the collagen, and it is not as easy to separate them as the epidermal cells. They are loosely connected continuously. The turnover is only in one direction for few millimeters. On the other hand, the hair follicle, the hair grows from the hair bulb and goes up to 2 meters. So it is a very firmly woven structure, which is highly, it is very tough keratin and collagen. So it is not easy to separate these cells. So that's the hurdle. That's the rate limiting step, as we call in the chemistry.
Hi.
Thank you so much, Dr.
Hi, last question from actually. So I have a question. What is the purpose of using the collagen 1 actually?
Collagenase 1.
Sorry, collagenase 1.
Yeah, so this is exactly was the purpose, that if we can disintegrate the collagen and to improve the cell yield. So we could improve the cell yield.
So melanocytes are very sensitive, and the trypsin which we are using, it should be like 0.1% trypsin is better for the cell suspension method. And instead of collagenase 1, use collagenase 4. It's better to use collagenase 4 because collagenase 1 has more tryptic activity as compared to collagenase 4.
Okay, that's
So
that's
that
a
will
good
give
suggestion.
the single suspension method will take little more time at 37 degrees Celsius, but the viability will be more as compared to collagenase 1.
Okay, thank you for the suggestion.